Hello, hi everyone. Welcome to yet another D-Life Diploma course review video. As you know, D-Life Diploma is the globally top course now in metabolic health and disease reversal, created by our brilliant pioneer Anup Singh. Today with us we have Dr. Aditi Kothurkar, who has completed the D-Life Diploma. Welcome, Doctor. I'm going to introduce you and then we'll start with the review.
Sure.
So Dr. Aditi holds MBBS and as well as DNB in anesthesiology. She has been working as a senior consultant at a very large tertiary care hospital in Pune and has been practicing in this field for the past 28 years. So a long experience here. She has
Yeah.
also done a short stint in the UK, worked abroad, and has been a faculty for postgraduate programs. Interestingly, she also did a different diploma in nutrition and dietetics before coming to D-Life. And I'm going to ask her about that as well. So yeah, welcome to this review session, Dr. Aditi.
Thank you. Thank you so much, Mandar.
All right, so we'll get started. So
Yeah.
while we sort of read out your professional background, I want to know, how you came to this field or how you got interested in metabolic health. A bit of your journey, if you can share with our viewers.
Yeah, sure. So as anesthesiologists, actually, we are sort of the perioperative physicians of a surgical patient. So we need to optimize their metabolic, chronic conditions before they go in for surgery, to, have better surgical outcomes. And also it has a bearing on the recovery from whatever surgery they are having. So over the years, we have seen not only an increase, exponential increase in these chronic diseases, but even younger and younger patients are coming to us for surgery who have these diseases. So it is quite, challenging at times because they are on multiple drugs. The severity of disease is quite a bit. So managing all that during, when they are under anesthesia is quite challenging. Not only that, the pattern of the metabolic disease is also a bit different nowadays. I say that because, my husband is a vascular surgeon and he deals with a lot of vasculopaths. So, what we didn't see maybe 20 years ago, like aortic disease or autoimmune diseases causing vasculitis, these sort of patients have started coming into our practice. So there was a definite link to our diet, current diet and lifestyle. That is what we thought. And the kind of diets that these patients were following was also, they were quite counterintuitive. I mean, if we ask a patient who is coming in for surgery that what did you have, before you started your fast, before your surgery, invariably 90% of them would say, yeah, we had tea and a couple of biscuits. Yeah, so not only patients, I mean, even in our families, if we hear things like, oh, I must eat now, I must eat this much so that I can take my medication, So that seemed a bit counterintuitive to me. And there's a definite gap, therefore, in how these patients are being managed and what should actually be done there, and maybe specialization and super specialization in our field has sort of, made the healthcare quite fragmented currently. So, and then during COVID also, we've seen that, these patients with metabolic diseases fared rather badly. And during that time as well, we got some time, to reflect on what is happening. And I think at that time, I thought that I would like to explore this space. So I even signed up for a different diploma online. And while I was talking to one of my colleagues who is your wife, she did mention that you are getting a lot of success, in reversing these types of diseases. And I also attended a talk of yours, and where I thought that, yes, this could be something which I will be interested in. And then, of course, we had a one-on-one talk, and I signed up for the D-Life course. Yeah, so it was a long time, but I finally, I think, landed in the right place.
Yeah, absolutely. No, it's been great to see, doctors like you join. A couple of reasons that I say that, because you guys see situation on the ground and you have had a long
Hmm.
experience. So in fact, you must have seen things change also over a lot
True.
of these years.
Yeah, so what we learned in the 90s as preventive medicine, it is not applicable anymore. We learned more of communicable diseases and undernutrition rather than what we are facing now. So, yeah, so we really need to relearn a few things.
Very true, very true. I also find one thing fascinating that uh, I mean, you can sort of tell me what the statistics could be roughly, but out of, sort of 10 cases which come to you in the operation theater, and all of you, of course, manage them anesthesia wise so much
Mhm.
around, perioperatively. So out of those, so it used to be sort of my thinking that yeah, there will be some mixture of trauma as well as conditions
True,
which
yeah.
arise from metabolic conditions, right? Metabolic
Mhm.
diseases, dysfunction. But in your observation, what takes the bigger load, or what is causing most of the people to come for surgeries?
Yeah, most of them would come for, some of them, of course, as you said, would come for trauma related or something like hernias or something like that. But we do see a lot of patients now who come in for gallbladder surgeries, gallstones, chronic pancreatitis needing endoscopies, which used to have a certain subset of population who were, prone for that. But nowadays we are seeing it across the board, across ages, and in patients who don't really fit that etiology that we had in our mind. So definitely that is a change, and yeah, so we are facing more and more of this in even surgical and other patients.
Absolutely. So while you have been busy, I know how busy you guys can get. Sort of plugging this hole all the time, sort of, fighting this fire.
Yeah.
The footfall that all of you get in large hospitals,
Yes.
sometimes it's quite concerning. But it's great to see some of our doctors in D Life now also willing to work on the side where we can do true prevention and at least reduce that
Yeah,
sort of a load on the healthcare system, because otherwise I don't think in this fashion we can continue, and it's
that's
very
true.
difficult.
Because hospitals are now filled with patients who need care for complications of chronic diseases rather than coming in for acute conditions. So that is a
Absolutely.
bit of a crunch that we are facing. Yeah.
Yeah. So yeah, let me come to the course. So while you were doing the course, over the several months, I know you did that while managing all of your,
Yeah.
clinical duties, working as a doctor. So first of all, how was that? How did you sort of manage that? And then secondly, how did you feel the overall support that you got from the D-Life ecosystem?
Yeah, regarding this course, I think because it is self-paced, you're not pressed for, any timely, um, uh, you know, course material which has to be submitted or things like that. It made it easier, while working full time as well. So that was a good thing. Another thing was the all the modules were so well researched and presented. Especially, I was taken in by the audiovisual material also that was included, and that sort of made it simpler to go through it quicker, and it also exposed us to the global stalwarts. I mean, that certainly led me down several rabbit holes, and it makes you inspires you to seek more different perspectives and more information, definitely. Another thing was that there were constant uploads. So while I was doing the course also, there were a few new things which were uploaded. So that is an ongoing or an evolving nature of this course comes through in that. Of course, the forum, I can't talk more. I mean, it's such a great resource because I did feel a bit overwhelmed at the beginning, while trying to navigate through it. But once you get the hang of it, I think it's a great resource and it is really invaluable to the course. And it is not just theory because it's all those real life cases which have been included and their success stories. All that is really inspiring. And of course, the template that you get for reversing metabolic disease, I don't think that is available in any other course worldwide today.
Yeah,
So
great. Yeah, great to hear that. And for our viewers, I must reiterate that point, right? So she is somebody who is a very busy doctor. They do odd hours, long hours at work, but still it can be managed. of course, what I see in you and doctors like you is, that curiosity is there, and then there is something in your practice that you are seeing the shifting trends,
True.
and
Yeah.
you sense that there is some missing piece, and you want to go address that. So, which is actually quite heartening to see and amazing. And we are always very fond of all of our, medical professionals at D Life. Right. So as you now, you have completed the course, I'm sure there are some lifestyle changes that you may have made, at your personal level or family level. And then
Yes.
as you come to the conclusion of the course, sort of, are you taking up maybe some cases, or are you advising a few people here and there? How is
Yeah.
that going?
Yeah. So currently, my in my family and in my um, sister's family and things like that, I have started advising a few people. But yes, I'm hoping to get more acquainted with D Life and its going forward. I would like to be associated more with this D Life, and
Absolutely.
I will keep a separate time, of course, because as you know, in my practice, our time with patients is limited. So I will be keeping a separate time to pursue this definitely.
Great. And we do look forward to, all of that participation. One thing I must ask you, since you come from medical background, right? So were there pieces where you had to sort of unlearn and then learn on the metabolic health front?
Yeah, rather than unlearn, I would say that we have been taught very, in a fragmented manner. Like we learn biochemistry in 1 year, then medicine comes in the third year. So its actual application to disease is something that we had to learn. Like why is this, like some things like hypothyroidism and hyperuricemia. Honestly, I hadn't connected it to insulin resistance till I did this course. So for us, metabolic syndrome was mostly obesity, diabetes, hypertension, and leading to its complications. So the whole gamut of symptoms that can come with this was something which I learned only after this course. So that was really enlightening.
Great, great. And then I'm sure if you now get any of those cases, you'll be reversing them and helping them see the overall bigger picture of the chronic disease, because, they come together as a syndrome. They're not necessarily separately. I mean, we tend
Yeah,
to treat them in silos, but they are sort of connected at the core anyway. Great,
that
great to talk to you, and great to know all the advice. So the last question I typically ask at the end is,
yeah,
if there are colleagues of yours or people from similar backgrounds, whether medical or even outside of that, if
yeah.
they are sort of looking at the life, they are thinking about it, maybe they are on the fence, what would you tell them?
Well, certainly I would push them to do this course right away, and and they shouldn't waste their time looking for other things. Like, I've been through that. So they shouldn't waste so much time in that. And it is the best investment that they could have ever made, because this course equips you to deal with clients. It is not like any other theoretical course where you're left high and dry at the end of it, wondering how to actually apply it to clients.
Absolutely. I think that's a great line. I'm going to use that. And somebody of your background, deep expertise, and also, of course, having explored other courses, when you say that, there is a lot of weightage to it. So I'm looking forward to this video coming out. It will be there on our D Life channel anyway. Yeah, great. Thank you so much. Any last comments, and then we'll pause.
No, that's what I said. This was the best time investment that I made, I think, in a long time, and I hope to reap its benefits for my family as well as the clients who I may be able to help in the future. So this is the best thing that has happened to me, I think. So thank
Perfect.
you so much. Thank you so much. Yeah,
Thanks
and
for the review. Thank you
yeah,
so much, Dr. Aditi. Yeah, bye.
happy Diwali to all of you as well. Thank you.
Happy Diwali to you too. Thanks. Bye.
Bye.